Hi, I'm Matt, and welcome to the Strong and Healthy Rehab channel, a place to discuss all things rehab. In this episode, we are going to discuss the initial evaluation, what it is and why it is important. The first thing to know about the initial evaluation is that we need you on the schedule. We got to have it scheduled before we can do it, before we can start your rehab. People come to therapy in one of two ways. I do have a video on this, which I will link in the description below. One way is through a referral from another provider. This is just when another provider just says, hey, I believe you would benefit from physical therapy, and they send over your information. Typically, what will happen is that the clinic, someone at the clinic, will contact you because they have your contact information and get you on the schedule. The other way that people come in is through direct access. Now this, we don't have your information, so you will need to put forth the effort to contact the clinic and get on the schedule. Now you can contact the clinic yourself, even if you have a referral, even if your physician or whomever referred you to a different clinic, you can pick wherever that you want to go. Once your initial evaluation is scheduled, the next thing you have to do is that wonderful paperwork. There is a video on this, which I will link that below as well. This paperwork just goes over your personal information, your past medical history, and gives us consent. If you're interested in knowing more about it, check out the other video. Now that you've got all that fun stuff out of the way, scheduling the appointment and doing that wonderful paperwork, we can actually get to the initial evaluation component of it. The first part is what we call the subjective component. And really what that is that we're just having a conversation. We as therapists want to understand what you are dealing with. How long has it been going on? Did something specifically cause it? What kind of things are you not able to do? Fully you can't do, or maybe that you're just really severely limited in doing. We also want to know what things you want to get back to doing. So something that you put forth as what we call a goal for the future. We can also ask clarifying questions because, again, if we just get information from another provider that you've told, little details may get left out. And specifically in therapy, we do want to know those little details at times because it can affect your treatment. So this typically takes up a significant portion of the initial evaluation, but is very important because it allows us to understand what you are dealing with. After the subjective component comes the objective component. Now, what are objective components? Those are measurable things. So your therapist may do something like looking at your range of motion. So like seeing how far you can lift your arm or bend over or straighten your knee. We may look at that. They'll use a little tool called a goniometer to measure those things. We may look at your strength to see how strong that you are with doing certain things. We may look at visual components of things as well, such as having you walk, having you bend over to pick up something, having you to reach something. Because you could describe, well, I'm having difficulty doing this. Well, demonstrate it for us because that allows us to see, are there any kind of movement deviations or anything that's just really coming out at us. Also as well, looking at visual, it lets us know about anything like swelling, redness, coolness, if anything's changed in color, that's important as well. If you have an incision, we're going to look at the incision to make sure that there's no infection or anything in there. We may also do what are called special tests. These things allow us to have a better idea of what is going on. These tests all vary. It may be looking at something such as, is something very loose? Is something too tight? Does something produce pain or your symptoms? If we do it, your therapist will talk to you more about that as they take you through that component of it. Likewise, we may do a series of tests. We may have you do a series of activities and grade you on them. Now, the therapist may or may not tell you about it because if we tell you about these things, sometimes it could bias the outcomes of it. So we want you just to do it as naturally as possible. We do utilize these things for several different things. One, it lets us set goals for the future to see if you are improving. It also lets us know if you're not improving, or likewise that you're getting worse. Your insurance company, if you're going through your insurance, do want to see these as well. They want to see these objective measurements on things that you can and cannot do, or again, losses of motion, losses of strength. They want to see those objective measurements. So that's a component that we will frequently go back and look at again. Now that you've got the subjective component out of the way, you've got those objective measurements out of the way, what next? Well, I'll tell you as a therapist, I'm not going to miss an opportunity to start on your rehab. It doesn't matter if you've been dealing with something for 10 minutes or 10 years. We're not going to wait another day and let another day go by without working toward those goals that you want. So your therapist may start again with some exercises or activities to start to work on increasing your motion, again, increasing your strength, or to start decreasing your pain. Once your therapist and you have completed what they want you to do on that day one, typically, again, those exercises or activities are not going to be super involved because you've been there for quite a while. If you've been sitting up there doing paperwork for a while and then you've come back talking with them, it could be close to an hour or so, and they know that you're probably pretty tired and pretty worn out from doing those new things. But they're going to give you something called a home exercise program. Those are typically the activities or exercises that you may have been doing. The purpose of these is to continue working on those limitations or things that we may have noticed in the objective component and have you start working on them. Your therapist will talk to you more about that once they give that to you. All right, you've told your story. The therapist has taken all those measurements. You've went through some exercises. You got the stuff that you need to do at home. What happens next? Well, first off, your therapist may go over your treatment plan with you. Again, it may be at this visit, it may be at the next visit or so, depending on do they need to really interpret all the results and tests and things that they did. But the treatment plan is just what it is. It's the plan to help you reach your goals. That can include specific exercises and activities they want you to reach, along with specific milestones over that period of time to, again, ultimately reach those goals. They'll also include how often they are going to determine that you need to come in and see them. This can depend on several factors. One, the complexity of what you've got going on. Additionally, your schedule as well. That plays a factor into it, along with about how long they believe it will take you to fully reach your goals. Lastly, you got to schedule your future visits. So once you're in there for the initial evaluation, they do want you to get on the schedule so that you know when you need to come back in. Yes, typically with rehab, we want you coming back in. Your therapist will go over that. They will go over with the frequency, so how many times a week and for how long. Again, this is based upon really their professional judgment, so that they feel, hey, I believe it would take about this long. It may or may not. Again, your therapist will go over that with you. All right, so what happens next? So once you're done with all that, well, really the work for you is done. The work now falls back over to us, the therapist. What we're going to do is just write up your initial evaluation. So everything we spoke about, everything that we saw, we're going to send that over to your referring provider to, again, let them know what we found and what we plan with doing. Likewise, if you're going through your insurance, we're going to send that to your insurance company to, again, let them know what we found, what limitations that you have, so they will pay for your therapy. Now, we as therapists will reference your initial evaluation very frequently. We like to go back and look at it to see, are you making progress, or are you staying stagnant, or maybe you're getting a little worse. In those cases, we may change up with what we are doing, or possibly we may have to refer you to another provider because what we are doing is not working. There you go. That's the initial evaluation. If you enjoyed this video, please hit that thumbs up. If you have any questions or comments, please drop them down below. And of course, please support the channel by hitting that subscribe button. I hope to put out this information as much as possible because ultimately, what I want to do is keep you strong and healthy.